Day class. In the previous video, we have studied the first principle of acupuncture and Moxibustion, which are cultivating the mind and maintaining the qi. During your practice, it is very important to maintain the mind. To maintain the mind, it's also very important to create the relaxed environments. However, in the meantime, we have to study the proper or the strong manipulation techniques. We actually have to study all kinds of techniques that we can apply in our practice. But in specific situation, you don't have to apply the same techniques on the patient. But as a practitioner, you have to know how to perform all kinds of techniques. In this video, we are going to study the second principle, clearing the heat and warming the coldness. In order to apply this principle in your practice, firstly, we need to identify the heat and coldness. How to differentiate the heat and coldness will be based on your syndrome differentiation. So I trust all of you still remember the syndrome differentiations according to the 8 principles, coldness and heat. So we need to identify the heat or cold. We're going to use some techniques, either from acupuncture or Moxibustion, or different manipulation techniques in acupuncture or Moxibustion. When we see a patient with excess heat, we're going to use the techniques to expel the heat, to expel the wind heat, accompanied by wind, to clear the toxic heat, to unblock the orifices for heat syndromes. The warming coldness, we use different techniques to tonify yang qi, to warm the meridian, to smooth the meridians, expel coldness for cold syndromes, as you can see here. Very importantly, the heat syndromes and the cold syndromes. So these are the principles, one of the most basic principles of your treatments. You need to identify it is a heat syndrome or a cold syndrome. For instance, a heat syndrome, the patient may present with red tongue, pulse. And then you can also see from the coating, a cold syndrome, you can see from pale tongue, swollen tongue with teeth mark, white coating, slow pulse, or weak pulse. And try to differentiate from all these different symptoms and think about the pathogenesis. This is real different syndromes, different pathogenesis will affect our treatments. For example, stomach 25, 偏疏. This point, previously, we said that this point can be used for both constipation and diarrhea. This point is also very important in menstruation problems. This point can activate the blood circulation and reduce the blood stasis. So it can be used for the blood stasis in the stomach, the intestine. It can be used for dysmenorrhea or amenorrhea, so painful menstruation or no menstruation, or even delayed menstruation. However, the same points of stomach 25 also can be used to tonify the qi, to stop bleeding. Now, in this situation, we can use for bleeding in the stomach or intestine, excess bleeding in a period. As when we use, well, when we apply stomach 25 to these two very different patients, we use different techniques. The first one, we're going to use acupuncture. We're going to needle the points. The second situation, we need to tonify the condition. We can use Moxibustion instead of needling technique. Another example we can see is 还原. Just double check the points. 还原人 4 or 人 6. 圣枢, the back 枢 points which related to the kidney. So just double check the points. 带脉 三阴交 spleen 6. These 4 points, the 还原圣枢带脉三阴交. These 4 points. With the needling technique, you can clear the lower jaw, clear the lower jaw heat and dampness. So it can be used for pink leukorrhea. This leukorrhea also can have like smelly leukorrhea. But with the same points, these 4 points, when we use a Moxibustion, we can warm the lower jaw. So it can be used to clear the cold dampness. In this situation, we can use for excess leukorrhea, especially the excess white leukorrhea. First is clearing the heat. This is referred to the excess heat syndrome. The possible causes can be the exogenous wind cold or wind heat. Sometimes you will confuse how the wind cold can be in the excess heat category. This is at the early stage of a wind cold. No matter exogenous wind cold or wind heat, once the result in a superficial heat syndrome, then we can apply the clearing heat principle. Qi stagnation in 脏腑 organs results in the internal heat. Qi in blood stagnation also will result in heat. So in this situation, we can use clearing the heat principle. How to clearing the heat? The principle will be quick technique or fast. Anything fast or quick. For heat syndrome, we can use acupuncture with feeding foam needles, shallow insertion with short period, reducing the method for prick for bleeding. This principle described in 灵书 says 热 集之 热者集之 热 the heat. So someone suffer from heat. So these two words 集 quick, 之 no meaning, only to create the pattern of 4 words. As you can see here, the whole paragraph we are discussing here, in Chinese, only 3 words. We can describe all these information. This is also another reason why I encourage you to learn some basic Mandarin. Because once you understand Qi, these words, Ji, once you understand these words, you will know this technique requires something fast. So we can use prick for bleeding. As you can see, for prick for bleeding, in the prick for bleeding, we use the 3 edge needles. So we don't even leave the needle there. The technique will be achieved less than 1 second. Keep the needle for a short period. We're going to have shallow insertion. So we don't keep the needle too deep. We don't insert 2 or 3 cun. We only keep half cun or even 0.3. It depends on the location. But the general principle will be something quick, something shallow, with short period. So this is the clearing the heat. Once you diagnose the syndrome, the principles, the applications will be followed by the syndrome. For instance, a patient suffers from common cold, presents as the common cold due to wind heat, presents as runny nose, sticky phlegm, and sneezing, slightly red tongue with slightly yellow coating, slightly sore throat. In this situation, we can choose 214 大椎、曲池 large intestine 11、合谷 large intestine 4、三焦 5、外观. These points can assist to clearing the heat, expelling the wind. And then if those patients accompanied with the sore throats, swollen throats, lung 11, we can use the technique of prick for bleeding. This can help to enhance the effects, especially to relieve the sore throats. If after a few days, this patient wasn't healed, and then the heat travels into the internal organs. So this will become superficial syndrome into internal syndrome. Once you go to internal, we use the normal needle technique, the filiform, deep insertion, keep for a longer period, and then we still use reducing manipulation technique, such as the comprehensive technique, cooling the sky, or other reducing manipulation methods, such as the lifting and thrusting and rotating, or even according to the direction. So we can apply all those techniques in the needle techniques in our treatments. Warming the coldness. In this situation, the patient suffers from excess coldness. Excess in coldness is the same as excess coldness because the in only to describe the coldness, to emphasize that the coldness is in. Possible causes can be the exogenous wind cold, EPAN syndromes due to cold dampness, a lock in the meridian, internal cold syndrome, deficiency. We can use the Moxibustion or the acupuncture with filiform needle, deep insertion with longer period, restore the yang qi. When you see the principles here for warming coldness, you see the deep insertion with a longer period. This is very similar to the previous slides when the heat develop internally. We still use deep insertion with longer periods. We may use the cooling the sky comprehensive manipulation technique to reduce the heat. In this situation, we may use the comprehensive to increase the heat, but in deep insertion and with long period. At the beginning, when we introduce the clearing the heat, we emphasize for clearing the heat, we use shallow insertion, keep for a short period. And in the previous slides, we said when the heat develop into the internal organs, we can keep for a longer period with deep insertion. So when you see from these descriptions, you will understand that these principles are not absolute. So you need to keep in mind, you need to memorize these principles, understand these principles, when to use, but don't stuck on these principles. Sometimes you need to adjust the principles. Sometimes you need to change the principles. Why in the previous slides, since we emphasize the principles, but how can you change them? In the previous slides, when the heat, that's a yang pathogen, develop into internal organs, This is the yin location. Compared with the superficial level of the body, superficial is yang, internal is yin, the heat is yang. The heat in the yin level, which is the heat developed into the yin in the internal organs. This is the combination of yin and yang. Once the situation changes, our treatment principles also need to change to adapt to the situation. So just in general, warming the coldness, we use the warming technique to treat the coldness. For this situation, we're going to keep for longer periods, such as half an hour, even 1 hour. When we discuss the clearing heat and warming the coldness, we emphasize these surgeons, the difference between these surgeons, and then we need to focus on the differences, and then we need to identify the accurate surgeon, and then we can apply clearing or warming techniques. It seems that there is a clear line between the heat and the coldness. However, sometimes the heat and coldness is not that obvious. Sometimes they mix, such as the superficial heat with internal coldness, or superficial coldness with internal heat, or the heat in the upper jaw, the coldness in the lower jaw, the heat in the lower jaw, the coldness in the upper jaw. We still have the true heat and false cold, or true cold and false heat. All these deep comprehensive situations, we can combine the clearing and warming techniques. For example, a patient suffers from fever, thirst with no desire to drink, only prefers to drink small amounts of warm water, prefer warmth, perfumes, clear urine. In this situation, we can apply clearing heat to clear the fever, the thirst, the heat. But why does patient have no desire to drink, or only prefer to drink small amounts of warm water, not the cold water, but as we said, the fever and thirsty is the heat. A heat patient will prefer to drink cold water, but this patient prefers to drink warm water, prefers warmth. Perfumes clear urine, that indicate the coldness. So this is a situation, the patient suffers from both heat and coldness. So in this situation, our treatment, we will focus on the warming the internal coldness. For the Yangming, for the Tai Yin. For Tai Yin is the spleen. For the Yangming is the stomach. So we can use stomach 36, spleen 6. Reinforcing manipulation technique or Moxibustion. In the meantime, we can focus on the hand Yangming, large intestine, hand Tai Yin. So here's the hand, the lung meridian, such as large intestine 11, large intestine 4, and lung 7. Acupuncture with feed-foam needles. For lung 7, we can use the reinforcing and reducing technique according to the direction. Another patient suffers from upper jaw, the heat in the upper jaw, coldness in the lower jaw, for example, irritation, thirst, dry throat, sore throat, or runny nose, sneezing, red tongue with slightly yellow coating, thin yellow coating, abdominal pain with preference for pressure, loose stool, or even diarrhea, cold extremities. All these indicates the heat in the upper jaw, but internal coldness in the lower jaw. So we can use Moxibustion on room 6, rung 4. Spleen 6. You can clear the heat in upper jaw. You can use rung 17. Pericardium 6, lung 7. Sometimes the students will ask, in this situation, can I use lung 11? Large intestine 11, or lung 7, or lung 11? Large intestine 4. Can I use these points similar to the previous slides? Can I use apart from these? Can I use this group of points? The answer is yes. So as long as you keep the principle correct, your treatment's actually quite flexible. That's also why we said that you may get different treatments from different practitioners. As long as the principle is correct, then you can choose. So this will be very similar to in future in your test. If you use different points, you are recommended to follow the experience from the textbooks. But if you prefer to add your own points, you can do so, but you need to explain the reason. You need to tell me why. Okay. When you tell the reasons, you need to tell from the principles, which principle you will follow. In this video, we mainly discuss the second principle, clearing the heat and warming the coldness. Although it is very important to differentiate the heat syndrome and the cold syndrome, you still need to keep in mind that the heat and the cold sometimes can combine to each other. So there's no clear line between the heat and cold. You need to differentiate based on the patient's syndrome. So you shouldn't put in mind that this patient, you shouldn't keep in mind in advance that this patient should be cold, this patient should be heat. All your differentiation need to base on the patient's syndrome and the patient's symptoms and syndromes, as well as the pathogenesis behind these symptoms and syndromes. In the next video, we are going to discuss on the reinforcing and deficiency and purging the excess. Thank you for your attention.